will have the AeHIN Performance Review 2011-2014 and online consultation for general membership for activities of 2015 to 2017. I am Aliyah Evangelista from the Secretariat of the Asia eHealth Information Network. AeHIN received another funding from NORAD and other partners and are now planning to ramp up capacity building activities for more members of the network. And this webinar will orient you of the activities for the last years of AeHIN and will open the floor for possible activities, trainings, and certifications which will help you grow in the field and will help your country achieve your eHealth goals. Some announcements before we start the session: our platform, our ways to participate, our program details, and the email feedback. First off, we're now using Cisco WebEx Event Center, and our link is bit.ly.com/AeHIN Consultation. If that link is not working, you can readily go to bit.ly.com/AeHIN Hour. Our room number is 868-894-870, and our password is Manila123. You will be mute for the rest of the meeting, but you can actively participate in 3 ways: by sending your feedback, your response, and posting your questions. You can send your feedback by clicking the feedback button on the right side of your screen below the participants window. It's a dialog balloon with a check mark, and on that drop-down menu, you can respond by a yes or a no, say the presentation is too fast or too slow, and appreciate the speaker with an applause and a virtual laughter. If you can hear my voice very well, please try giving me a check mark. Thank you, Dr. Marceline, for your check. Thank you, Gilbert. Thank you, Bayanmuk Batulga. For the others, I hope you could send your check mark so that I could be informed if you can hear my voice very well. For the chat box, you can also send your message to the host or to the panelist in the chat box beside the participant button. And I strongly recommend that you chat your thoughts and insights within the meeting room. But you cannot chat to everyone, but only to the panelists of our meeting room, because that will be useful as we progress in our session. So that's my note. You can only chat to either the host and or panelist or presenter and not to all meeting participants. But later, our co-chairs and some of our colleagues will be raising your chat and your questions in our meeting room. Next, you can also post your question by first assigning your question to whoever in the panelist. Do you want to raise your question? You can also type your question on the box located on the lower right panel of your screen. And lastly, please do not forget to check your emails, as the Secretariat will be emailing you an evaluation form of this session. So that's the 4 things you have to remember: the platform, our how to participate, our program details, and our email feedback. This session will run for 45 minutes to 1 hour. Please send your questions and Q&A to the box that I have pointed out earlier as it arises from your head. Our speakers for this afternoon are our co-chairs. First off, I would like to introduce Dr. Alvin Marcelo. Dr. Alvin is a general trauma surgeon by training and is currently the chair of the Asia eHealth Information Network. Prior to this, he served as a Senior Vice President and Chief Information Officer of the Philippine Health Information Corporation. And as a Director of the University of the Philippines Manila National Telehealth Center and Chief of the Medical Informatics Unit, Dr. Marcelo established the Masters of Science in Health Informatics program and conducted local and international research in the field of eHealth and health information systems development. He took his postdoctoral fellowship in the medical informatics at the National Library of Medicine in Bethesda, Maryland, with research interests in telepathology, mobile computing, and bibliometric analysis of Medline content. Dr. Marcelo also manages the International Open Source Network for ASEAN Plus 3, a center for excellence in free and or open source software established by UNDP, and advises the Community Health Information Tracking System, a Stockholm Challenge finalist in the health category in 2006. He is the Philippine representative to the Asia Pacific Association for Medical Informatics and the International Medical Informatics Association. Dr. Marcelo is certified in the governance of enterprise IT and the Open Group Architecture Framework. Our speaker for also in this afternoon is Dr. Bunchay Kidsinayutin, who is also co-chair of the Asia eHealth Information Network. He had worked in a rural public general hospital for 15 years as an internal medicine clinician before receiving PhD in health informatics from the University of Minnesota, USA in 2008. His working areas and research interests are national health information standards, e-health, health information exchanges, and health IT adoption. Currently, he is the health informatician at the Thai Health Information Standards Development Center, Health Systems Research Institute at the Ministry of Public Health, Thailand. Please welcome our co-chairs, Dr. Alvin Marcelo and Dr. Bunchay Kidsanayutin. Hello, Dr. Alvin.
Hi, Aliyah. I hope everyone can hear me and they can click on the check mark if they do so I can get feedback. First of all, allow me to greet everyone a Happy New Year and also thank you for joining us today. I can see a lot of familiar faces, familiar names on the list, of course, and I'm happy to see you. I don't want to go to the list one by one, but almost I think everyone here have already been to an AeHIN event or has received an AeHIN scholarship. And I think there's a lot of interest on how we are going to allocate our resources for the next 2 to 3 years coming from the NORAD funding. So allow me to use the next 15 minutes to give you an overview of what has transpired and then also what has come out from our previous meetings, consultation meetings in Kunming, in Sri Lanka, and in Manila last year, and also then open the floor to the audience to ask them what other ideas they might have as to how we can improve the network. So this is a review of 2011 to 2014 and then followed by an online consultation. So the objectives are simple: share the past activities of AeHIN to the membership and then consult you about other ideas that you might have for the future of AeHIN from 2015 to 2017. The outline will be very quickly the AeHIN story. I know that a lot of you already know it, but for some of you, this might be your first time. The AeHIN National eHealth Capacity Roadmap, which is the framework that we're using right now in designing our capacity building programs. And then a quick run-through of our certified AeHIN members on HL7, TOGAF, and COVID-5. And then very, very, very roughly and at a very high level, some activities that we might want to do for 2015 to 2017. But I'd rather not go too much detail until I've heard from the general audience today. So the origins of AeHIN started in April 2011 when the World Health Organization organized, together with USAID, organized a health information systems interoperability workshop in Hoi An, Vietnam. That's where I met one of the first few core members of AeHIN and some of the general members right now. And in that meeting, we agreed that we all shared the same problems. We all had problems with standardization, interoperability, and we didn't know how to start solving these problems. So that meeting ended with more like people having a shared experience and knowing that there are kindred spirits in the other ministries of health in other countries, but not really any solutions. Luckily, in June of the same year, 2011, just 2 months later, more or less the same people were gathered in Manila at the WHO Western Pacific Regional Office for the Asia Pacific Leadership Forum on Health Information Systems. And in this meeting, the same people who were there in April in Vietnam thought that there is a lot of value in getting these people who share the same problems together to talk about how they've solved their problems. Because in fact, some of them have already achieved headway in solving these problems, but not all of them knew how these problems were solved by the others because this was the first time they were meeting each other. So myself, Dr. Bunchai, and several others proposed to WHO to have a planning meeting in Bangkok on December 2011 to talk about how we can create a learning network, which is now what we call the Asia eHealth Information Network. And in that planning meeting, we all agreed that if we get enough support and resources to bring people who are in the field of e-health at the national level, at national scale, then we would be able to learn from each other and support each other when it comes to designing and implementing our national health information system. So with the support and funding from WHO, IDRC, Rockefeller, NORAD, and other partners, we had our first general meeting in Bangkok, Thailand in August of 2012. And here we presented and the general membership approved a 4-point strategy. First, that AeHIN should find ways to enhance leadership and governance in e-health. AeHIN should build capacity for e-health. That the network should nurture e-health through peer networking and knowledge exchange. And that the network should be a strong advocate in the promotion of standards and interoperability for health information systems. It was also in this first meeting where the WHO ITU National e-health Strategy Toolkit was launched. And these are the participants. You might see some familiar faces in the participants. We had over 120 people attending that conference. Then the second general meeting was held in Manila, September 2013. And this time, other development partners had shown interest and they wanted to hold their own side meetings together with the general meeting. And so we had the IT for Universal Health Coverage, or IT for UHC, which was the interest of our partner GIZ, and the regional workshop on country health strategy, which brought in experts from WHO Geneva to help countries in CRO and WIPRO on writing up their national health strategies. It was also in the second general meeting where we formed the AeHIN Working Council. The AeHIN Working Council are volunteers from the member countries of Asia who are interested in advising AeHIN on the next steps that we can take. And that was actually the first formal consultation process that we had, and that was very, very helpful. And up to now, since September 2013, the Working Council has been meeting at least quarterly online or face-to-face. It was also at the September 2013 meeting where we had our first batch of AeHIN members who finished their HL7 online course. One of the frameworks we're using right now at AeHIN is what we call the National eHealth Capacity Roadmap. And this is in recognition that national health information systems are very, very complex because you need a lot of support from the higher ups, as high up as the Minister of Health, sometimes the President or the Prime Minister of the country, and also capacities at the operations level, people who manage the servers, who make sure that the networks are always connected, make sure that the viruses are not spreading within the network. So there's a wide range of stakeholders and many, many components to make a national health information system run optimally. And so we realized that for each of those stakeholders, there should be appropriate capacity building activities for them. So here you see in the roadmap that at the bottom, the WHO ITU e-health strategy toolkit is at our base because we believe that a country must have a national e-health strategy from which all the other activities will commence. After the strategy, then there should be a governance mechanism to support that strategy. And this is where we believe the ministers of health, the ministers of ICT, their respective vice ministers, the health insurance agencies should have knowledge on the proper governance of national health information systems. And that's where we've looked at COVID-5 as our framework. Then when you look at proper IT governance, inside that IT governance framework, there is one important task called Managed Enterprise Architecture. And for Managed Enterprise Architecture, we selected TOGA, or the Open Group Architecture Framework, as our capacity building program. And so forth and so on until we get to standards, which is composed of ISO, HL7, and IHE, and with program management, such as PRINCE2 or PMP and ITIL. And I will be relaying to you, this is the roadmap that we're following right now. I'll be relaying to you some of the achievements that we have reached over the past 3 years on these capacity building programs. Then the third general meeting of AeHIN was held last December in Manila. This is the first time I met Dr. Mursaleen from Pakistan. And it was back-to-back with the measuring and achieving UHC with ICT because UHC, or universal health coverage, has been increasing in terms of importance amongst countries. And we believe that ICT is an important enabler into achieving UHC. And in that meeting, the participants agreed on what we call IC10, or 10 actionable items in the short term that they can start doing and implementing that can help them ensure the achievement of their universal health coverage with ICT. And you can view the whole IC10 by going to bit.ly/WHOADB AeHIN IC10. By the way, at the bottom of every slide, you will see a link, and that is the link to the slides of this presentation. So what have we achieved in the past 3 years? We've done a lot of trainings and certification. So on November 2012, we had 26 participants from 19 countries taking an HL7 online course. We had 11 participants from Mongolia and the Philippines taking an enterprise architecture training in Ulaanbaatar. We had 15 participants from 9 countries who took an introductory course on DHIS2 in Vietnam. Then we had 18 participants from 7 countries who took another course on enterprise architecture, or TOGA, in Kuala Lumpur. And then 33 participants from 9 countries who took a certification program on IT governance. So the online course right now for standards is we've offered HL7, and we plan to offer the same for OpenEHR and ISO in the future. DHIS2 is actually an application, and when DHIS2 offered to have a program in Vietnam, and they invited participants from AeHIN, we gladly supported 15 people from our network to participate in that course. COVID-5 is an IT governance framework, and the 33 people who took the training were very satisfied that they were able to learn a lot about how to organize very, very complex systems like national scale health information systems. And COVID-5 would give you the handles for that. And then TOGA is the Open Group Architecture Framework in case a country decides to adopt an enterprise architecture approach in organizing its national health information systems design and implementation. So all in all, we have in our network 26 certified on IT governance, specifically COVID-5. We have 9 who are officially certified as enterprise architects with TOGA. 12 were certified from the 26 who participated on HL7. And the HIS2 right now is not a certification program, so we can only count the number of people who have attended the HIS2 training. AeHIN also supported national e-health related events. So we sent resource persons to the Indonesian Health Informatics Conference called FICI last April 2012. I participated in the International Society for uh, Disaster Crisis Management, or ISCRAM, in Colombo, Sri Lanka. Dr. Bunchai and I and other AeHIN members were in Dhaka for the Possible M Health event last June. And we sent a contingency of 25 AeHIN members to the China Health IT conference in July 2014. Dr. Jakir from Bangladesh was one of our participants there. And then, although we could not send resource persons to the Health Informatics Society in Sri Lanka last October, we made available for them our WebEx platform for the whole duration of their conference. And that we were not able to send, I was not able to join the APAMI conference in New Delhi, but Mr. Jai Ganesh, who is one of our working council members, is also one of the organizers of the APAMI New Delhi event in November last year. In terms of using our WebEx platform, we have a long list of AeHIN hours already that we've delivered. And we have started to make available the WebEx platform, which is a 500-seat platform, very expensive, but supported by WHO, down to the country level. And Thailand, Cambodia, and Sri Lanka, and Bangladesh have been able to avail of this platform. All you need to do is just coordinate with Aliyah, and if the time slot that you need it for is available and the topic is about e-health, then you are free to use the 500-seat WebEx platform, which I think is about $5,000 to $10,000 value a year. So you might want to take advantage of that. Then we put up an ahinacademy.org website. Basically, AeHIN contracted Dr. Peter Drury, the author of the WHO, one of the authors of the WHO ITU National E-Health Strategy Toolkit, and asked him to map the strategy toolkit with our National E-Health Capacity Roadmap. And Dr. Peter Drury has made available 8 sessions on e-health strategy, IT governance, enterprise architecture, standards and interoperability, and program management. And feel free to take that course and use it for your own courses if you are affiliated with the university. So in review, our National E-Health Capacity Roadmap, we are now at the point where we already have IT governance certified people. We have enterprise architect certified people. We have HL7 certified people. And the next step based on this roadmap would be to get ISO and IHE certified people, PRINCE2 or PMP certified people in the network, and then including ITIL. These are on the short term what we have already planned to do in the next 2 years. And so I now open the floor for ideas from the audience on other suggestions that they may have as to what they might expect from AeHIN in the next 2 years. Aliyah?
Thank you, Dr. Alvin, for that very comprehensive review of our activities. You may now use the chat box on the lower right panel of your screen for your suggestions for activities which can be funded or which can be organized by the network. If you also want to talk to Dr. Alvin, I can unmute you and speak in our meeting so that you could discuss more of your ideas and insights. I would like to also recognize some familiar partners in our meeting room. Liara Tutina from Itsido,
Liara.
Dr. Shinji Kobayashi from OpenHR, and others are still coming. So any chat from our team?
I think Dr. Shafat Khan has a question.
Okay, Dr. Shafat. Okay, I would like to talk, Dr. Okay, I will unmute you, Dr. Shafaat. Uh, please stand by. Dr. Shafaat, I'm patching you in. Hello? Could you speak to your microphone? Or I think you're online. We can see that your voice is on. Just speak before
Dr.
your
Shah
microphone.
can speak or can chat also on the window. I think Dr. Mursaline also has a question.
Okay, we just got a chat from Dr. Pam, Pamod. Pamod Amar. Okay, it's from this is also from Pakistan, I believe. I would suggest some summer schools be designed for such activities. Summer schools for activities. Suleiman, are you talking about e-health programs for summer schools? I hope you could clarify it on the chat box. While waiting, we have a chat from Pamod Amarakun. Dear sir, there will be a DHIS2 Academy in Vietnam in April 2015. I'll be grateful if you could offer sponsorship from AeHIN for participation for this event. Thank you. How about that, Dr. Azin?
Actually, one of the suggestions that we have received from the people who were in Vietnam for the DHIS2 workshop is that they are requesting for the next level. And so, yes, we are considering allowing another session, another round of participants in a DHIS2 event. However, we'd like to spread the people who are attending these conferences. So there might be a new set of people who will be attending this DHIS2 Academy meeting. Um, um, I have been, Dr. John Bra and John Lewis were here last December at the AeHIN third general meeting, and I promised that I would pursue how we can operationalize both a face-to-face and online DHIS2 academy training. So the answer is yes. We will find a way to offer DHIS2 training again. Over, Aliyah.
All right, so we take note of that response. We're receiving some chat from Dr. Marcelin, support for national e-health strategic planning and support for its implementation, development of the national e-health roadmap through Health Informatics Department of local HI University. I think Dr. Marcelin is talking about how universities could be of help to national e-health strategies.
This is a very, very good suggestion, Dr. Marceline. Definitely, rather than just support the academic units for purposes of academics, we want them to actually apply the theories and concepts into a practical matter, and nothing is as practical as actually supporting a country's development or drafting of a national e-health strategy. So yes, Aliyah, let's plug this into one of the activities. It would be helpful if we can, rather than go on a per country basis, we can hold a a right shop in a country somewhere in the middle of Asia, and then get several countries together, and then have experts come over to advise, such that at the right shop, then the participants who would necessarily be representatives from the Ministry of Health and perhaps Ministry of ICT, and also the academe would have some rough outline already of their national health strategy. So good suggestion, Dr. Bruceline will take that on.
All right. Thank you, Dr. Marcelin. Here's a chat from Mark Pettifor, who is from Cambodia, and um, his chat is in December 2013. WHO prepared a report on growing an e-health strategy in Cambodia with a series of recommendations, but progress is not clear. Could AeHIN help with that?
Um, Yes, essentially, what AeHIN has been trying to do is really support the World Health Organization at the ground level and more or less helping out, uh, be the eyes and ears and also the hands on the ground where it is possible. Um, the working council members of AeHIN are actually representatives also from the ministries of health and ministries of ICT and relevant NGOs working on e-health in those countries. So to a very large extent, they are able to observe and also raise capacity building gaps or gaps in resources that may be preventing the country from moving forward in terms of their national e-health strategy. Um, the WHO is doing a good job in putting up the frameworks, such as that one that came out from the WHO ITU National Health Strategy Toolkit. But in reality, it's very challenging also in many countries, especially those that have not yet been able to elevate the topic of e-health to the highest level of governance. That means that's the president or the prime minister of the country and the minister of health. And what we found out is that the course or the capacity building program on IT governance helps a lot because the IT governance, in a way, simplifies the very, very complex activity of creating a national health information system into doable tasks or doable boxes for specific sets of people who need to perform a specific type of work within that complex national health information system. So, for example, if you are a minister of health or a minister of ICT, then you may be very, very far away from the management of the national data center because that's very technical and that's far from the work that you're supposed to do, which is policy making and regulation. But at your level, at the minister level, it it is your purview and perhaps only your purview to set the expected benefits from a national health system, set the acceptable risks, and make sure that resources are available to the implementation team, to the e-health implementation team, so that they can deliver on the benefits that you expect from them. And that's what we've found out that IT governance, such as COVID-5, has been able to contribute to the discussion. Ali, I was sharing the whiteboard. Maybe you can
Ah,
share the whiteboard
sorry.
also. Can you type on it, Aliyah?
At the moment, I can't type on it, but I
Okay.
think it's because you're the panelist, still the panelist.
Yeah.
We have two more chat from Indonesia and from Pakistan. From Indonesia, from Professor Anis, Indonesia is planning to host the new FICI in the second semester of this year. Is it possible to receive support from AeHIN again?
Dr. Anis, please, I consider this that you're already registering a request. So we'll put it in the set of activities and let's synchronize our timelines so that if we can find common, uh, a common mutually acceptable agenda, then yes. You know, we've supported CT already. We've supported HISSL already. We'd like to spread it around also so that the other health informatics societies in the other countries will also receive support. But since you've registered already, we'll put it on record. Yes.
Okay. Essentially, we just want all your ideas and insights, and we will later on see on how this fit the agenda of AeHIN. Next is from Pakistan. Can we submit a proposal for some country-specific support?
The answer is yes, but AeHIN basically will now then consolidate if other countries also have a similar request. And if there are more countries who have the similar requests, then what AeHIN does is we consolidate the requests and then get all of these countries together in one activity. But if it is only benefiting one country, the support, for example, in CITI, which is a National Health Informatics Conference, we were able to send 1 to 2 resource persons as speakers. But if it is like a request for a write shop on National e-health strategy, we basically will relay this to the World Health Organization because that is their capacity building program, and then consolidate the resources of maybe 3 to 4 countries. And that becomes cheaper to manage because now rather than WHO going one country at a time, we can actually bring 4 to 5 countries together in one place and have efficiencies and economies of scale.
Okay. As we are from Pakistan still, we are PAC One Health Alliance. We are hoping if there is a possibility that we can receive technical and financial support for electronic surveillance systems for zoonotic diseases in Pakistan. There is a plethora of information being collected by different departments, but there seems to be a gap or lack of coordination between different departments. We feel we should bring them all together to tackle zoonotic diseases more efficiently. Thank you.
Yeah, so our answer to that question will be that fits within the capacity building program on IT governance. What we've found out is that unless there is very clear IT governance, then the projects appear like they're convoluted and not integrated in a coordinated way. And so the way AeHIN will support that is basically advise the countries, the members, AeHIN members in that country, to submit and apply for the IT governance capacity building program. The reason is if the country then has a pool of people who are knowledgeable about IT governance, then they can start organizing these many projects, and all of them are important. All of these important e-health projects into a consolidated framework that is useful for the country that can be consumed and understood by the higher ups. IT governance helps in making heads and tails and in understanding why are we investing on the TB program? Why are we investing on the malaria program? Why are we investing on this mHealth program for smoking cessation? All of these programs are important, but unless you use an IT governance framework, then it would be hard put to show the people upstairs, the Minister of Health and the Minister of ICT, how all of these different investments are actually contributing to the bottom line of the country, which is service to the people. So the answer is no, we will not. AeHIN does not go at the country level and intervene at the country level. However, if that country can benefit from a capacity building program together with 3 or 4 other countries, such as IT governance, then we will now invite that country to participate in the capacity building program, and hopefully that will solve some of the problems that they're encountering. Aliyah?
All right. From Mark Cohen. Excellent presentation. As a new participant, it offers a great summary of AeHIN activities and achievements. From a capacity building perspective, the group may want to consider establishing some capacity in key e-health terminologies, including SNOMED CP, LOINC, and others to augment the HL7 data structured focus training.
Oh, yes. One of the activities that I'm writing up right now is basically a workshop on standards and interoperability. So definitely this suggestion will be on the board. We are trying to find a way to run this once and then make the content available so that other universities within the countries can propagate and replicate the process. So I'm writing now a TOR on e-health standards and interoperability, and our reference for the TOR is the Joint Learning Network ebook on information system standards and interoperability, which we distributed at the last AeHIN conference. By the way, in the JLN ebook on standards on and interoperability on eHealth, they mentioned specific standards that are balloted internationally and have a long history of good governance. So those are going to be the standards that will become part of the workshop, AeHIN workshop on standards and interoperability. We're targeting around May of this year to have that workshop. Alia,
All right.
can you share with them the link to the JLN ebook?
Yes, I can share it now. I will just look for it, and I will also send it in the email feedback that I will be sending after this session. Okay, from Dr. Fazila from Malaysia. Malaysia still needs support in terms of participation and certification for capacity building in governance, EA and e-health strategy, and also project management.
Dr. Fazila, Malaysia is the most advanced Asian country in e-health right now, and if you're requesting for that support, then we will give it. So if we can consolidate, again, the answer of AeHIN and the Working Council is if we can get three or more countries who want to have the same capacity building program, AeHIN's answer is yes, let's do it, because we can now have a efficiency in the money that we have and the exposure that we are going to get in terms of how many countries will benefit from that single activity. Yes, Dr. Fazila.
Okay. From Gilbert Mina, he has a chat. To make learning and capacity building more interesting and fun, is there a possibility to offer connect or inter-op hackathons for the network, a training or workshop to come along with it too, perhaps?
Again, sorry.
He's asking for connect or inter-op hackathons for the network.
Okay, that's interesting, Gilbert, because one of the activities that we will be proposing for the next 2 years is a regional interoperability lab. With AeHIN, we will be putting up a cloud-based regional interoperability lab where we will have all of the standards and resources available so that the countries can start putting their hands around these standards, and then also making available experts who can advise the countries on how to appropriately use the standards. Um, the the interoperability is very, interoperability is a very complex term because some countries are already challenged with interoperability within their country, and so much more if we start talking about inter-country interoperability. So the concept that we are proposing at AeHIN is that let's have a regional enterprise repository. Think of it like a box of Lego blocks that's available to all of the member countries in AeHIN. You can get your blocks from that box, and you can start building your prototype health information systems, and you can do that for your country and just for your country. But later on, because all of the countries pulled their building blocks from the same enterprise repository, then the interoperability is much more ready between countries rather than them not pulling their building blocks from a common repository. Aliyah?
Okay, that is interesting, and it will require a lot of organizing, but I am very positive that all of our members would be happy to participate. From Bangladesh, from Dr. Maruf Khan, late Happy New Year. Do you have any plans to support or offer PhD program as part of capacity building?
What AeHIN is doing right now, Dr. Maruf, Happy New Year too, is to network the degree granting universities so that there will be a system of student exchange between the countries. Having said that, one of the things that we'd like to explore is the possibility of actually sponsoring a few postgraduate degree students who will commit to work on a regional interoperability project. If the students will commit that their thesis project or their project within that program will be on the AeHIN Regional Interoperability Lab, then we can support them to some extent. Perhaps not the whole tuition. We'll target for the whole tuition, but if not for the whole tuition, to some extent, some degree of costs that they might incur, like travel or conference support or stipends. But in the end, the support that should go to the student should not just be a personal benefit to the student, but more of a network benefit. And the network benefit is basically the interoperability lab. So if the student is willing to do this, then yes, we will support it. As a matter of fact, there are already scholarships available from some of the universities. I know Taipei Medical University has a PhD scholarship that's available, and I'm sure that the other universities will start offering slots also. So AeHIN will be talking with the university. We've talked to 4 universities already, and we plan to talk to the Asia University Network, which is based in Bangkok, at the end of the month. I will be in Bangkok together with Dr. Bunchai. Over, Aliyah.
Okay, we have more questions from our participants, but I would just like to add to Dr. Maruf. AeHIN is currently and still working on mapping universities and academic institutions in Asia offering health informatics degree programs. We have released one poster just detailing or identifying the universities in Asia offering health informatics degrees. And if you still want to contribute to the list of those academic institutions in health informatics, that would be very helpful to our network, so that we could also approach them one by one if a collaboration for scholarships would be possible. From Melissa Chu, I have one suggestion. One future agenda is regarding data mining. If we could keep in mind how health data is mined while we are building informatics infrastructure, it would enable very efficient data mining. My experience with New York City's primary care information project has shown that planning citywide e-health systems with data mining in mind greatly enables all sectors to make full use of the data captured by our infrastructure. This data will help countries make informed decisions in a timely manner.
I like that, Melissa. Can you nominate somebody from New York City's Primary Care Information Project, or even yourself, to make this presentation in an AeHIN hour? We would be very interested in learning more about how that's done in New York.
Okay, so we'll follow up with Melissa. I have also her email through this webinar. From from Win, Nepal WHO representative is requesting a technical support from AeHIN, example National Interaction Program. I'm not sure if I could disclose this information during this point of time, but maybe you would like to give us, Nepal would be approaching AeHIN specifically for this request, National Interaction Program.
Feel free to email me more details, Doctor. Then I will be able to respond specifically in more detail. Well, I'd like to reiterate that at the country level, AeHIN, at the country level, what AeHIN can do is consolidate our needs for capacity building. So if 3 or more countries need capacity building on IT governance, and they raise their hand on this, then AeHIN will now say, okay, we will now host another training program on IT governance, or another training program on enterprise architecture, or another training program on standards and interoperability. and then open that up to the membership, and the membership will then apply for that course. Um, However, at the down to the country level, we usually work through our respective WHO regional offices. So you can relay that request to your regional office. You can copy AeHIN if you wish, and then together AeHIN and WHO regional office will work through addressing those needs. Yes, for Nepal.
Okay, we have two more ideas. I recognize Melissa Chu agreed to have the session. I will just follow up with the exact schedule with you, Melissa. Thank you. From uh, from Bangladesh, from Muhammad, one of our graduates in our AeHIN scholarships. Bangladesh is working to achieve UHC. For that, IT is one of the major equipment. Therefore, we need support on this regard for the key personnel who are closely involved with this. Any possibilities for AeHIN to support this initiative? I think he's talking about IP, UHC for IP.
Yes. So for Muhammad, I think what we've already AeHIN has supported quite a number of Bangladeshis already in the HL7, in the COVID-5, and in TOGAF. I don't know if there's in TOGAF. What we need to do now is basically assess after all of these trainings that the key personnel in Bangladesh have already received. What gaps remain? And if these gaps are still also shared by other countries, then we will consolidate those gaps together, and Bangladesh, together with other countries, will then receive capacity building to fill in those gaps. That's the advantage of AeHIN, is that we are able to maneuver along the lines of the needs of the countries and consolidate common needs. So if my suggestion to Bangladesh and to all the other countries is, why don't you get all of the people who already have finished HL7, have finished IT governance COVID, have finished EA TOGA, and ask them, how can we now use the training that AeHIN gave you to organize our national e-health program? Um, and then, after you've met and you've agreed that this is how you will now put in the HL7 knowledge, the TOGAF knowledge, and the COVID-5 knowledge together, you will then still realize that there are still gaps somewhere there. And I'm already presuming you will have problems with program management. That's why we're going to have Prince 2 and PMP. And you're going to have problems with service delivery, and that's why we're offering ITIL. But other things that you can identify, if you can pin those down, then we can address those capacity gaps with a training program.
Okay. I am receiving more and more ideas from the floor. I will first read um, Pakistan, Malaysia, and then the others. From Pakistan, from Mohsin Arshad from Pac One Health Alliance. Sir, what can be done to obtain training and support for conducting webinars and electronic trading sessions?
Well, very easily is you can schedule to use the AeHIN WebEx platform if you need an audience of more than 500 people. If you don't need an audience of more than 500 people, I think Google Hangout performs very well. If you have an audience of more than maybe 20 to 30 people and your topic is on e-health, I suggest that you use the country AeHIN hour facility for that. How does that work, Aliyah?
That's a good idea, so that all the activities for larger activities will be hosted. I suggest that Pakistan create the local AeHIN hour for the country, like what Bangladesh, Sri Lanka, Thailand, and the Philippines already started, and Cambodia also. If the secretariat can teach you how to use this platform and lend you and also help you strategize on how you could engage more e-health professionals in your community using that online uh, webinars. I mean, online platform. Thanks, Mohsin Arshad, for your question. For your question from Malaysia, I think, from Dina Nur Anggraini. Could AeHIN support ebook and eLab HIS, the system, the server for each country? From Indonesia, maybe we can support to translate it to Indonesia language so each city or country can access it easily. Ebook and eLab health information system.
I can't see that question, but if I can, uh, essentially the reason we're putting up the regional eHealth interoperability lab is because this regional interoperability lab are actually architectural artifacts that the AeHIN member countries can reuse for their local consumption within their country. So the approach that is being proposed right now is from an existing application going back to the repository. That is also possible. So if there's already an existing solution, such as the e-logbook or the e-book, then all we need to do is deconstruct that into its architectural artifact and then put it in the shared architectural repository for AeHIN. And then other countries can now benefit from the lessons that they were able to obtain from Indonesia. I think I'll reserve another AeHIN hour to explain more about the AeHIN Regional eHealth Interoperability Lab and Enterprise Repository. There was a question from Dr. Fazila as to what tool we will be using. There are really limited sets of tools right now that are non-proprietary for Enterprise Repository, and the one that we are using right now in the Philippines is called Essential. Essential is an enterprise repository tool which is open source. And we prefer not to use a proprietary tool right now because we don't have the capability to support the licensing requirements for all the countries. But for open source enterprise repository tools, then it's more or less available to everyone very quickly. Thank you, Bayan. Bayan says it's a good idea.
Okay, thank you, Bayan. Bayan is from Mongolia, I think.
Dr. Bayan.
Okay, lastly, we have from Sri Lanka, from Gumindu Kulatunga. How can AeHIN Secretariat help on continuous professional development of postgraduate Masters of Science graduates trained in medical doctors, trained on medical informatics in Sri Lanka? Continuous professional development of postgraduates in medical informatics in Sri Lanka.
Yes, my suggestion, and this of course will depend on each country's environment, is that we start using the online conferencing facilities to reach out within our country. So if you are a graduate of a medical informatics degree program, and we know that there's a lot of need for capacity building even within the country, like how to teach the nurses how to ethically record health information in an electronic medical record, how to keep data secure, private, and how to practice ethically and manage health information. These things you can already do within your country. And my suggestion is you follow the script that we use, the one that Aliyah used earlier in the first part of this talk, and start organizing your own country AeHIN hours in your own language. In your own language, through your informatics society, or if you don't have an informatics society, you can start building your own. But having a monthly or a weekly topic that's available online for free for as many people within your country on the topic on e-health, I think that will really be very beneficial for your country. And at the same time, you're starting to build capacity within your country for e-health. If your audience is going to be more than 25 people, you can borrow the AeHIN WebEx platform. The only conditions are the topic should be on e-health. You should submit a proposal, a two-paragraph proposal on what the topic will be, and that you will submit a two-paragraph report on what transpired. Very, very easy. And that's all we're asking. And the facility is actually very expensive. It's $5,000 a year. And the more people who use it, the better for AeHIN because it's going to be an optimally and maximally used resource. Over.
Okay. And if you have questions, you could also reach us through Viber. We'll just post the numbers via email so that if ever you want us to contact you regarding the AeHIN WebEx platform. I think we're okay. Thank you very much for your participation. We are 11 countries in this meeting room from Pakistan, Thailand, Mongolia, Sri Lanka, Bangladesh, Philippines, Indonesia, Malaysia, Thailand, Vietnam, Maldives, and Japan. I will be asking Dr. Alvin to have a summary of our talk. Go ahead, Dr. Alvin.
Yes, thank you, Aliyah, and thank you to everyone for joining us this afternoon. We got a lot of ideas here that confirm some of the ideas that we already were able to collect in the Sri Lanka, Kunming, and Manila conferences, and there are new ones that we will now add into our list of activities. What's going to happen? We are going to have a strategic planning meeting in Bangkok, Thailand on January 27. I will be with Dr. Bunchai, Dr. Win Min, and our Thailand AeHIN members. We will consolidate all of the ideas that we were able to collect from Kunming, Kuala Lumpur, Ulaanbaatar, and Manila in the past year, and then come up with that list and prioritize them. After we have prioritized them, we will then put them into timelines, maybe one workshop every quarter or more if we can get more resources. And then we will now select the venues. Perhaps the next point on the program is that if you are willing to host a venue in your country for an AeHIN activity, let us know in the mailing list so that we can consider your country as a venue for an AeHIN workshop or an AeHIN event. So with that, I'd like to thank everyone for participating and for sharing their ideas. Special thanks to Melissa Chu, who we have committed to an AeHIN hour to talk about the New York City Primary Care Information System, and also to Dr. Mursaleen, Dr. Fazila Muhammad, and Pamod, Gumindu, Suleiman, Dr. Bayan. Thank you very much for being here, Dr. Jasim. I'm sorry if I cannot call everyone, Mark Cohen, Petifor, and everyone who's here. I hope to see you in the next one, Yara, Tutina, and I'd like to see everyone again in our next topic, which will be, what is it, Aliyah?
Our next AeHIN hour will be on January 29, and we'll ask if Melissa can take this slot for our AeHIN hour.
I hope Melissa will be available.
Thank you very much. See you last Thursday of January.
All right. Thank you very much, everyone, and a Happy New Year. See you in the next AeHIN hour, January 29. Over and out. This is Alvin from Manila. Bye.